Well, thanks for joining us again on Healthy Living South Mississippi. Back with Dr. Reagan, a retina specialist in Mississippi. Good morning.
Good morning.
How you doing?
I'm doing very well, thank you.
Well, we're going to just talk today generally just about overall eye health. So, general rule of thumb, why do we need to get an eye exam? Other than just like if you can't see things far away, if you have vision problems.
Well, certainly there are things that can develop later on in life as we get older that can lead to vision problems and vision loss. And so getting an eye exam is the first step in diagnosing those things and helping to prevent any vision problems or problems with your eyes throughout your life.
So eye diseases, conditions that maybe your eye care provider would recommend you see a retina specialist for. What are some of those?
So one big thing in our community is diabetic eye disease. Severe uncontrolled diabetes can lead to complications with the eyes and potential vision loss. That's something that I see regularly. I'm often referred patients for that. Macular degeneration is another big one. I have a lot of patients that come in and have potential vision issues from macular degeneration and need regular treatments for that as well.
And of course, with diabetes, it's not just diabetic eye disease. We're talking about glaucoma as well. There's other issues specifically for those patients who have diabetes. But then again, we've spoken before. You can look into somebody's eyes that have no idea about diabetes and know if that's what if they have that.
Yeah, certainly. You can almost diagnose someone with diabetes from some of the changes you can see in the back of the eye.
So adults, we're talking about adults. If you're 40 years or older, you need to be coming in to get your eye, just a general eye health exam once a year?
Sure. I would probably think it's a wise idea to get your eyes checked once a year if you're an adult 40 or older. Obviously, we may not all feel like we have the time or availability for that. So, maybe even a little bit more leeway, but certainly once you're in your 50s and definitely 60s, you should be definitely getting an annual eye exam.
But if you have family history or other conditions, these are things that knowing them, even if you don't feel like you have an issue right now, knowing that this is something that exists in your family, is this a good reason to maybe give a call?
Absolutely. Having a family history of eye conditions, or whether it's glaucoma or retinal problems, that is a great reason to have your eyes checked early on.
Also, if you are working in an environment where it's hazardous conditions, you definitely want to get in there and you want a doctor to come in and take a look just to make sure that there's nothing that could be causing problems because of your line of work.
Sure, that's important too. I mean, there are some occupational risks to vision, and of course, even everyone nowadays on all of our screens and computers can cause a lot of ocular surface disorder and dryness issues or eye strain. And so that's one reason. People who have visually demanding jobs and need to find that your eyes and your vision are important. You should have even more of a reason to get in and make sure you're getting your eyes checked to maintain eye health.
Sure. Now, when we're talking about eye doctors, we're talking about optometrists, ophthalmologists. What is the difference there?
Right. There's a lot of eye care providers out there. While most qualified eye care providers are able to examine and diagnose many of the conditions that can affect your eyes, some of these eye care providers have some additional or more specialized training, and which allow them to be more specialized, have more skill and knowledge and experience with dealing with some things. Certainly, some ophthalmologists and retina specialists like myself are trained to perform procedures and surgeries, for instance, and are better suited to handle some of these conditions.
And as a specialist, you are hyper-focused on a handful of situations and issues with the eye. What are just some of those?
So like we talked about, diabetic retinopathy and diabetic eye disease, macular degeneration is a big one. But a large part of my practice is dealing with things that can lead to something called a retinal detachment, and that can be retinal tears or holes in the eye. We can treat those and do surgery to help with retinal detachments. There are other conditions that can cause vision loss or vision problems in the retina, swelling in the back of the eye, whether it's from cardiovascular issues or strokes of the eye. There are things that can cause inflammation or bleeding or other aspects inside of the eye that can have vision problems, and things that retina specialists handle routinely.
Now, I'm glad you mentioned that, because I was about to ask, who is the kind of patient that would need to see a retina specialist? Definitely someone who has already experienced those things that you've just said. If you've already had a retinal detachment that's been repaired, you probably need to be seen by a specialist. How frequently?
at least once a year or more if there's a risk of any other problems, especially if you've got having had problems in one eye and the other eye seems fine. It's a great opportunity to see a retina specialist to monitor your other eye. If you've ever had any treatments to your retina before, it's probably a good idea to continue seeing a retina specialist for further care and management.
If you only have good health in one eye, not the other.
Yeah.
You want to protect that one eye that you have.
Yeah, absolutely. Patients who have one functional eye should be getting annual eye exams, and whether or not it's by a retina specialist, that's a very important reason to have regular eye checkups.
What are some of those other conditions that maybe people might not think is a reason I need to be making a phone call?
Things like new symptoms of vision loss or visual distortion, flashes in the peripheral vision, new floaters. Those are all things that eye care providers, but particularly a retina specialist, can help diagnose and see if that's a real problem or just something that can be managed.
Now, naturally, if you're going to get your vision checked, you're going to your eye doctor, they can refer their patients to you. But if you're watching this right now and you're hearing some of these symptoms that you're listing here, is it suffice it to say a patient can call you and self-refer themselves or self-refer directly?
Yeah, absolutely. I have patients call us up and make appointments for a lot of these reasons just for me to check up, and that's okay. I'm never gonna, scold anyone for coming and having a specialist like myself check them out. And while I do have many referrals from all the eye care providers in the area, I encourage people who are concerned about their eyes and wonder if they have a retinal condition to come and make an appointment. And there's power in knowledge, and letting me check is just an important part of that.
And I think it's important to know that anyone out there who's watching that has an eye care provider, that has a doctor they go to on a regular basis, for example, myself, I have glasses. So I'm there at least, well, I'm supposed to be there at least once a year, but I'm one of those guys that's like, I'm going to be fine. As long as I can see, I'm okay. But ECPs or eye care providers can diagnose early stages of those cases that you deal with on a regular basis. But when it starts to become more advanced, that's when they need to maybe come in and see you.
Sure. And one thing you can always ask your eye care provider, do I have a retinal condition? Would I benefit from seeing a retina specialist? That's something that I encourage everyone to ask. And certainly if there's any doubt, there's no harm in coming in and let me take a look.
And we've said this before, and it goes without saying, the alternative is not that great.
No, you definitely need your eyes and your vision. You only have two of them, and it's important to maintain that throughout your life.
To my knowledge, there's not a replacement out there yet.
Not yet.
That you can just plop in something and your vision comes right back to normal.
Not that I'm aware of.
Well, if you're having any of these conditions and some of these symptoms, that something is alarming you, if you have diabetes and you haven't had your eyes checked, that's an important step to take. You need to give Dr. Reagan and his team here at Retina Specialist of Mississippi a phone call, and they will get you on track to having great, wonderful, healthy eyes. Dr. Reagan, thank you so much.
Thank you.